the purpose of the Joint Information Center, or JIC. And of course, our agenda. Kicking it off today will be current situation report and Eric Pessel. Eric, go right ahead.
Hey, thanks a lot, Dirk, and good afternoon, everybody. As you can see, we're still, we're still receiving positive COVID-19 confirmed cases. We're up to 8,258 as of this morning. A total of 392 hospitalizations between all folks that we have record of that have been in the hospital due to COVID. We've had 218 deaths. The good news is, as you look at that bell curve on the right-hand side of the screen, you can see where we are still continuing that downward trend. Very, very important that we continue to see that downward. And, let's hope that over the next weeks and months, we'll really flatten that out and get down even further. Next slide. So our vaccine dashboard for today is just an update on where we're at from the Public Health Department. Currently, we have just ourselves administered about 12,416 vaccine doses into arms. And our state dashboard says that Calhoun County residents have received 24,110 doses. And that data is through February 23rd. I want to talk a little bit about our community partnerships. So they continue and they're strong. I can't say enough about Bronson Battle Creek, Oak Lawn, Grace Health for really stepping up and helping and doing this, vaccination of our population. We know we're going to be adding other partners as we go, more pharmacies and as well as providers and doctors' offices. We're not going to be able to do this alone. That's obvious. And, I feel really strongly that Calhoun County has a great, a great base of partners, and we'll continue to grow that as we move forward. But just some numbers just for the phase 1A facilities. These are facilities, not people. And you can see there, what each has been able to do to help get us through the 1A. And it's been a tremendous help. Basically the hospitals and Grace were only required to do their own staff and affiliates, and they've gone above and beyond that and are really working well with us. And so just want to give them a shout out today to make sure everybody understands that this is not us doing this by ourselves, but a whole lot of really good partners. Next slide. A little bit of data for our schools. People have been asking when our school teachers and staff will be vaccinated. I can say that, pending we don't have a major weather event at the end of the week or, something else happen that would cause us to have to cancel a clinic, I can say by the end of this week, we will have given at least one dose of vaccine to every school teacher and staff member that wanted it. And that's both private and public schools in Calhoun County. The number it looks like we're going to have is about 1,400, just over 1,400 so far. And I believe that will be added to at the end of the week. Today, Athens received their second dose. So everybody that wanted to get vaccinated in Athens School District, today was a good day for them because they are finished. And, within 2 weeks, they'll be fully effective and protected. We do continue to meet, and I continue to meet with the school superintendents through the ISD weekly, and that has been, I think, very beneficial to both myself and the schools to make sure that, they have a good idea what's going on in the county regarding COVID. What's the latest guidelines coming out of the CDC and the state, and just helping everybody interpret, those guidelines and the data that we're able to provide. And again, I know we've showed this in other formats before, but just to mention that in our cases that we have 0 to 17 years old, most of our cases are in that middle school to high school age range, the 12 to 17. With that, Dirk, I think it was my last slide.
Okay, Eric Pessel, thank you very much for your report. We'll move on to our guest speaker today to discuss MicroVaccination Clinics, and that is Carrie Whitfield. Carrie, take it away.
Is he on?
Are you with us? Okay.
If not, Dirk, I can actually take over this slide if he's not available.
Well, let's go ahead and have you do that, and then he could always jump in.
Okay. All right. Just a little bit of a background, and hopefully Kerry will be able to get on. Hopefully he's not having a problem getting on. You know, there's really what we are calling two different types of clinics. We have a mass clinic, which you guys have heard about. We've held some at the Y Center. We've held some at Dexter Lake Church. We've held some, or Oakland's held some in Albion and Marshall. We held one in Teconcha over the weekend. Those are large clinics. Typically, we want to see, you know, more than 600, up to 1,000 people a day in those clinics. And then we have what we call a micro clinic. And a micro clinic is smaller in size, maybe 200, 300 maximum, but the focus is different. The focus in a micro clinic is really looking at our communities that are underserved. So it's still the seniors right now, 65 plus, but we're really looking at our underserved communities in both Battle Creek and Albion, especially our communities of color, our Burmese community, and also our Hispanic Latino community. So with the help again of those partners I talked about, there's various clinics being held this week, as well as weeks into the future, that will actually micro target into these communities. So Kerry was going to speak to that and speak to the work that we've done with him and some other partners to make sure that we're listening to the community members, that we're going to where they're at. I think that's important, that, you know, some folks, they would be easier to uptake the vaccine if we can go where they're at rather than have them come to us for, you know, various reasons, not the least of which is transportation difficulties. And so, you know, we've reached out, and we're going to be providing some of these micro clinics in some of our local community churches and local community centers that that community is aware of and they're comfortable with attending. So again, we have been, you know, really working hard with this group to make sure that we are listening and that we are trying to address their needs as well as the needs of all of our seniors in the county. And we continue to do that. I see Carrie is now in the Zoom meeting. So Carrie, I'm going to let you take it over.
Wonderful. Thank you so much. I appreciate it. I appreciate your welcoming me to this meeting. Recently, we had the unusual but great opportunity of being part of this micro clinic where many of the urban community get the opportunity of getting their vaccination. The first of which is going to be at Washington Heights. That's tomorrow morning. Starting tomorrow morning. And it's quite interesting. It's interesting from the standpoint that there's a host of people interested in getting their vaccination. And this can be somewhat of a trial for many of the people in the community, because of course we still have those that are reluctant to get their vaccination. And after seeing those that go through the one here at Washington Heights, it is our hopes that they're going to begin to appreciate the idea that this opportunity has been made available to them. I guess I could put myself on the screen. The bottom line is that I view it as a major opportunity. The community views it as a major opportunity. And we're hoping that the message will be sent that the county, the city, all persons involved in COVID-19 is genuinely interested in making sure that all people have an opportunity for this vaccination. I've had the opportunity of working with Eric and much of his staff, and that's been great for me. They've taught me a lot, and I had the opportunity to just inject at some point in time my personal opinion, and they've actually listened, and I thank you all for that. And I'm recognizing now that we are moving in the right direction. When I originally came out of the hospital, I only heard negative stuff. I heard from members of the community that we're not going to take the vaccination, and for a host of reasons. Principal reason is that the medical community and African Americans has had some chattered past, and there was some questions as to whether or not this was a continuation on those past. And of course, we had the issue of people not recognizing that in 9 months, you can actually come up with a valid vaccination. And so we've had those kinds of reasons facing our African American community, and they were pretty perplexed by those ideas and just simply did not want to get engaged. The tides has now changed a little, and many people are beginning to move over to the idea that it's no sense in the continual reinfection of our community, because that's essentially what happens. We reinfect and we reinfect. And now we're actually putting forth the opportunity, and we have the tools and resources provided by the county to make sure that that doesn't continue to happen. We're moving in the right direction. And I thank everyone involved with the county and the city for giving us that opportunity. We're looking at tomorrow as being a very important date for our community, because this will be the first micro opportunity that we have. And so we're excited about it. Matter of fact, I just canceled my dental appointment that I had in Detroit so that I can go down there tomorrow and spend the day. But I'm excited. There was a lot of phone calls that we made. The people that we made phone calls to, they're excited. And so we're hoping that this is going to be a continuation of things that to come, particularly for our African American communities. And again, I can't tell people enough that we are grateful for the opportunity. If you have any questions, feel free to ask.
Okay. Kerry Whitfield, thank you very much for joining us, giving us that information. We truly appreciate it. Next slide, please. Moving on to the new community campaign. Fantastic campaign. And I'm going to turn it over to Lucy Blair. Lucy?
Hi, I am excited to continue the conversation along the lines of partnerships that we have in Calhoun County. The Public Health Department is working with organizations throughout the county of every kind, but of course that includes hospitals and other service organizations. And one of the things that was identified in those meetings was wishing that there was a unified campaign that would that all of us could be sharing the same message on. And so we created this PSA, a public service announcement, that encourages everyone to follow COVID-19 safety measures in order especially to reduce the strain on the healthcare system locally. So this campaign is available for all partners in Calhoun County who would like to share this message. There are 4 graphics and a video, as well as copy suggestions for this campaign for our partners who would like to share it. The video features Battle Creek businessman Michael Pignataro. And we worked with a local agency on this, Bluefish from Marshall. And so this was a really exciting local project where we all came together in order to help share a similar message. This is just phase 1 of the campaign. We will have a phase 2, and the phase 2 will be about vaccination encouragement. And if any of the community partners who want to share this, if you have questions or want ideas for how to share it, please feel free to reach out to any of the public information officers, and we would be more than happy to help. And that's all I have, Dirk.
Okay, thank you very much, Lucy, for that report. I really appreciate it. Next slide, please. We're going to move on to local event planning assistant city manager, City of Battle Creek, Ted Deering. Ted, take it away.
Thanks, Dirk. I appreciate it. Good afternoon, everyone. In general, we hope to share good news when we have these group presentations. I think that some of the data that was certainly shared by the health department earlier reflects trends and accomplishments that are headed in the right direction. And as a result, I know we are all anxious to get back to life as normal and celebrate with family, food, and friends. But we know that the battle isn't quite over yet. And as we think about warmer weather and the many great festivals and events that we typically have on an annual basis, we're desperate to want to go after a year of cancellation, but we have to be conscious and put health and safety first. So there are still public health orders that are in place that put restrictions on outdoor gatherings, and as much as we want them to, they're not likely to change significantly before summer. And we understand and appreciate, the amount of planning and preparation that goes into some of our larger events. And thus we're encouraging organizers to consider canceling or at least postponing those events until the fall. So I know that's not the message that we want to hear, but it's still imperative that we follow the public health guidelines. The city is not going to make its facilities and services available for events that don't conform with the current health orders. So let's be sure and just hang in there a little bit longer. Vaccinations are certainly on the way, and we hope we'll be able to gather again in the future. But I think we all agree that we don't want anyone else getting sick, and we certainly don't want any more loss of life before we can gather safely. Next slide, if you would, Dirk, please. Just some quick comments on the schedule for our team meetings. Quick update, our meetings scheduled, the EOC group that meets twice a week will continue to meet through March and April. The Unified Command Group meets at 8:30 on Tuesdays and Thursdays, and that will continue once again through March and April. The Joint Operations Center, our JOC, which meets once a week on Tuesdays, will continue to meet at 9 a.m. through March and April. And then these Joint Information Center briefings, or what we call the JIC, will continue with live briefings every other week, and then written updates on the alternative weeks as we have been. And again, those schedules are for March and April. Thanks, Dirk.
Ted Deering, thank you so much for your report. We appreciate it. Moving on to our next item on the agenda is comments from elected officials. We'll begin that with Senator Bison or a representative.
Hi, everyone. This is Karen from Senator Bison's office. Senator is in Appropriations Caucus meeting right now. On the constituent side, I just had a couple of things that came in over the past week or so from the office that I thought I would bring up here. Someone called and actually regarding a different issue, but mentioned while I was on the phone with them that they were on 3 different lists to be scheduled to get their COVID vaccine. And I thought, wow, that's quite a few lists that they were on. So I didn't know if that was perhaps more widespread or if it was just that person in particular who was on 3 different lists. And so I just thought I would bring that up. Not sure if other people are on those, are on multiple lists as well. The other thing is I've heard a couple of comments from the African-American community saying that they were passing up on registering for specific clinics because they wanted to get one vaccine over another. And so I guess if someone is on the line and can kind of speak to, is there a difference between like for example, the Moderna vaccine and the Pfizer vaccine? Anything that I can take back armed to tell these constituents, if they may have concern that they don't want to take one vaccination over another. And that's all that I have. Thank you.
Karen, thank you. Eric, do you want to comment on that at this time?
Actually, I'm not sure if he's still on. Is Dr. Nettleton still on?
Yes, I believe that he is. Dr. Nettleton?
Doc, would you like to take that? I hate to put him on the spot. I know he wasn't planning on talking. he might not be available.
Okay.
Can you hear me?
Yep, there he is.
We sure can, sir.
You bet. So I can just comment briefly about the Pfizer and the Moderna vaccines. Both are safe and highly effective vaccines. Approximately the same efficacy rate, which is the term that's used for how effective it is in clinical trials, approximately 95% effective at preventing severe disease and hospitalizations. That is tremendous. Both have gone through clinical trials that involve tens of thousands of people. Both the Pfizer and the Moderna vaccines have included Black and African Americans as part of those clinical trials, ballparking around 9 or 10%, depending upon the vaccine of those include from those communities. So they are both safe and highly effective vaccines. I know that folks have, a regional pride for the Pfizer vaccine being developed and distributed in West Michigan. But from a public health and medical standpoint, both are highly safe and effective vaccines. And both, I would recommend both for all of those who are eligible to receive either a vaccine when they're eligible. Over.
Okay. Dr. Nettleton, thank you very much for those comments. And Karen Todd, thanks for joining us today. We appreciate that.
Thank you.
Moving on to Representative Hatzma. Jim, the floor is yours, sir.
Thank you, Dirk, and thanks to all participating for being here today. Karen Todd indicated that Senator Bison is in the Senate Appropriations Caucus presently. We on the House side are waiting for some continued negotiations between the state Senate and the state House on appropriations negotiation in relation to the monies that we would like to appropriate, especially local government monies. I think the governor is waiting on both, so I'm anxious that we can get those parties together. That seems to be glacially slow, but I'm confident it will come together when it absolutely has to come together. Additionally, we continue to do, it seems more and more like pre-March 2020 activities here in Lansing. A session for the House starts in about 5 minutes. We've had committee hearings today in energy and in my other committee, technology. And in that technology committee, there's an interesting bill that's pending about an exemption for personal property tax and how that will impact upon local governments, especially townships, in context of exemptions for internet service providers who are trying to develop faster and more reliable internet service coverages in rural parts of our state. I'd like to ask, if I could, Dirk, a couple questions, one directed to Carrie and one directed back to Eric Pessel, if I could do that a moment.
Of course, sir. Go right ahead.
Mr. Whitfield, before you got on, Eric Pessel indicated that they're, in relation to the microclinics, are micro-targeting reach activities for especially communities of color. What are those? I don't think I heard what the reach activities, the communication activities actually were.
I guess I'm not entirely certain what you're asking me. Reject activity?
Reach, R-E-A-C-H, some communication tools that are being utilized.
Yeah, prior to the creation of these micro clinics, I was engaged with our community through the permission of the county and getting minorities to various other sites, mass sites as they would call them. And that was quite a, it wasn't so much of an undertaking, but an achievement, because we were able to get many minorities out that has been anxiously awaiting the opportunity that could not get out to these clinics via the permission of their doctors or via where their standings were in respect to being in line with the county and all that good stuff. So I was granted an opportunity of filling some slots that were made available either through absentees or whatever the case may be, which made a very important connection to our community because it was advertised on social media, and many minorities were seeing many minorities being given a shot that they had a great deal of respect for. And as a result, that ultimately changed the opinion of a lot of people that we're giving shots away to today. So we've had an opportunity of doing several things over the last several months, and it led up to these micro clinics. And the micro clinics is a perfect fit because now they can go in a community in which they're very comfortable and they're actually quite eager to do so, as opposed to being rather resistant to the idea. So hopefully that answered your question.
It does. Thank you, Mr. Whitfield.
Sure.
And Eric, I have a question for you too about something you addressed earlier.
Go ahead.
You indicated that, I think it was today, that the Athens schools administrators and teachers and parapros had their second dose. I'm curious, what percentage of those administrators, teachers, parapros in districts are electing to have the vaccines, if you know that data?
I don't know all of the data across the board, but anecdotally, teachers are a much higher rate than other staff. So I'll give you, for example, the one I do know about that would be a large one is Battle Creek Public Schools. I think we're at 88% of their teachers got vaccinated, got the first dose. But when you took into account all of their staff, about 65% chose to. So, I think the ones that are around each other and around the kids most are electing to do it. Some of the others, not so much.
Thank you, Eric. And thank you, Dirk, for giving me the opportunity to ask a couple questions.
Sure.
Oh, you're very welcome, Representative Jim Hodsma. Thank you so much. Moving on to Representative Hall, or the representative for Representative Hall. Okay, we'll move on to county elected officials. And hearing none, we'll move on to tribal elected officials.
No comments. Thank you.
Okay, thank you, Jamie. Appreciate that. City elected officials. And hearing none, we'll move on to township elected officials. And finally, village elected officials.
Yes, this is Mike Alverson, president of the Village of Athens. I'm glad I could join today. These meetings are very informative, so I'm going to try to participate when I can. So thanks for the invite.
Absolutely. Thank you, Mike, for joining us. We appreciate that. Okay, next slide, please. Next slide, please. Our best information sources. And we'll go to the next slide, please. And our contact us from the Calhoun County JAC Public Information Officers, Lucy Blair, Victor, and Jessica. And that should be our last slide. Any additional comments or questions from the group? Hearing none, we'll conclude this meeting. Appreciate your time joining us, and we'll see you live 2 weeks from today. Thank you so much.